It's Saturday night. It's time to get strange and unusual and weird, and we are going to do that tonight with our guest, Dr. Scott Kolbaba. We'll be talking about medicine and the paranormal. We'll be talking about some of the strange experiences that Dr. Kolbaba has had in his years as a physician, and also some of the other stories he's collected in his new book, Physicians' Untold Stories. We're going to get into some of these weird stories, but maybe you have some that you want to share yourself, and you'll be able to do that tonight during the show as well as we get ready for episode, I think it's 496. I legitimately don't know this time. Usually it's just shtick, but this time I really don't know. So I believe it's episode 496 of Spooky South Coast, and it starts right now. South Coast, Tim Weisberg here, along with the silent assassin, Matt Costa, science advisor. Matt Moniz is off tonight, and Stephanie Burke is off tonight. And just you and I, Matt, doing it old school style, going back to the first couple of months of the show when it was just us and the audience. At least we think there was an audience then. We're not totally sure. We don't have the data that proves that fact, but we got the occasional phone call. We got the occasional email. So there were people there, but we want to say hi to everybody that's out there tonight, especially out there in the chat room. Good evening to everybody watching live on Spooky TV, which you can get to by going to SpookySouthCoast.com or by downloading the free Spooky South Coast app, which you can get for Android or iOS. So you can watch the show while it's going on. You can see if I pick my nose during the show. You can see if I have to cough 100 times like I have the last couple weeks, which I'm already up to the first one for tonight. We'll see what happens the rest of the way. I'm already feeling it again. What is this? Is this allergies? I don't know what this is. But we will foster our way through that. But we're going to, as I mentioned in the cold open, we're going to be talking tonight with Dr. Scott Kolbaba about his new book, Physicians' Untold Stories. We're going to hear some of these strange and unusual tales from the medical profession. And maybe you've had some sort of strange medical experience. Maybe you've had something that's happened to you in the hospital, or you've had a loved one that has visited you maybe who had passed on while you were getting ready for surgery. All these different things are going to come into play. Premonitions. It'll be all on the table tonight when we talk with our guest in just a little bit. And in just a few moments, we're going to be talking about the week in weird. We're going to be talking about all the strange news of the week with Melody Knapp, our paranormal news correspondent. But before we do that, I just want to remind everybody that next weekend we will not be on the air, because it will be the Provincetown Paracon that Stephanie and I will be at, which you can still get tickets to by going to provincetownparacon.com. Tickets are still available. They've been running all kinds of great deals, so don't just go to the website. Make sure that you follow Provincetown Paracon on social media as well, so that you can catch some of the great deals that will be coming your way. And there is a whole bunch of media that's coming up for the Paracon this week. Sam's going to be promoting on a bunch of different media outlets, newspapers, magazines, radio stations, all of that. So make sure that you get your tickets now before they're gone. And we'll try and give away another pair again tonight. You know, nobody called in and won those tickets last week that are for the Saturday event portion. Nobody called in. We had you wait till the end of the show. We asked you a trivia question about the show. It wasn't that hard, but nobody called in. So we'll give away a couple of pairs tonight. Sam gave us a whole bunch to give away. He was very nice to get, and we haven't been doing it. So we're going to have to do it. And I have some ideas about how to do it on social media this week, but you got to earn them. You're going to have to promote them. You're going to have to promote the event for us. But don't worry, because here's how it's going to work. We're going to share all the Provincetown Paracon social media, all the Facebook posts, anything else. Share that all. So follow it right now on social media, Provincetown Paracon. And every time that they put something out, every time Sam puts something out, I want you to share it and tag me in it. And then everybody who tags me in it, I'm going to put everybody's name into a hat, and I'll do it on Facebook Live so you can see that it's, it's legitimate. And we'll do this on Wednesday night. On Wednesday night, so between now and Wednesday, as many posts as Provincetown Paracon puts out, and as many that are already out there. You don't have to wait for fresh ones. You can take any of the other posts that are out there as long as it's not, promoting a sale or anything that's over. Just share it, promote it, tag me in it. Make sure you tag me in it, Tim Weisberg, and I will write everybody's name down, and I'll put it into a hat, and on Wednesday night, I'll go on Facebook Live, and I'll pull it out. The winner, I mean. It's a good thing I stopped for that cough to have a moment to reflect on what I just said. So on Facebook Live, I will pull out the name of the winner from a hat. That's what I'm pulling out on Facebook Live. I don't want to get shut down. So that will be the time for that. So make sure you do that. But we'll also give away a pair or maybe even two at the end of the night tonight. So stay tuned to the show because you don't know what kind of trivia question we're going to ask you based on tonight's show. All right, so before we get into it with our guest, Dr. Scott Kolbaba, let's get a little bit weird with the Week in Weird.
Spooky South Coast presents The Week in Weird with paranormal news correspondent Melody Knapp.
And good evening, Melody. How are you?
I am doing great. How are you doing, Tim?
We are spooktacular. So, what do you have for us this week?
All right, so I've got two pretty different things to talk about. So first, we have an article about why are so many art exhibitions fascinated by the occult, posted by the Irish Times on how the present age of anxiety has triggered a new interest in the paranormal exhibit-wise. This article dove into the progression of paranormal perspectives artistically throughout trying times in history. A rise in exhibits focusing on the supernatural and occult stay true to the pattern artists have taken throughout the years. In other words, with our present age of anxiety, with everything going on in the world, it comes as no surprise that the resurgence of interest in the mysterious beyond is now being displayed artistically throughout the world. Just a little tidbit, the U.S., NSA memo from 1977 at the height of the Cold War does detail a CIA report on parapsychology experiments that they did that pretty much says grief is particularly associated with such phenomena as an interest in the supernatural and beyond and stuff. So it kind of makes sense as to why there is a rise in that.
Right. I mean, and I don't know. I really think that a lot of these experiences are emotional. And I think that being in an emotional place can open you up to having more experiences, more interest, good or bad. You know what I mean? Like, I feel like that in some ways, you have to be in a place of a little bit of vulnerability sometimes to have these things happen.
Oh, absolutely. Absolutely. And it makes sense, especially to us that are pretty well versed in the field. It makes sense with that emotion intact, why you'd have a rise in that. So
it's funny because I was watching earlier today, just flipping through the channels, Ghostbusters 2 was on, and they're talking about, the mood slime, the way that the paranormal aspect of what was going on was being affected by the emotions of people. And I was like, that's where I got that theory from.
It's all coming together.
Got it from Ghostbusters 2. That makes perfect sense. All right, so you said you had another story for us too?
Yes, I do. And this one we actually had a lot of participation in on Facebook, which was really nice. So this one was why the dying see their deceased relatives before they go. And it was actually a blog post written by Nurse194666 on WordPress.com. And this pretty much described the author's experience with her mother's passing. In short, her mom claimed to see her deceased husband at the very end, and although her vocal capabilities were stripped away from her, she did appear to be having a conversation with someone everyone assumed to be her husband, right before she went. And we did have a lot of people chime in saying that they experienced the same thing or had a relative that also experienced the same thing. And someone even mentioned, this is a term called fetching, and it's very well known that, they're called spirit guides to help you on into the other world. So,
yeah, I don't know if I've ever, felt like I had a spirit guide around me. I don't think I've ever felt like I've had somebody that's always been present around me that has been kind of guiding me in the right direction. Melody, do you feel like you have somebody like that around you?
No, I can't say that I do, but it would be nice or comforting, I guess you could say, to think that maybe family members would be there at the end to help you transition. But I mean, I can't say that I've experienced it myself, no.
Yeah, I feel like there's a lot of people that do, a lot of people that do feel like when they, I don't want to say it's fate or destiny. You know what I mean? Like, I don't want to say that it's, I'm trying to avoid the G word here, but a lot of people feel like it's, in some cases it's not God that makes them make certain directions, but that make certain choices and go in certain directions, but they feel like it's a loved one that's guiding them. And I don't know, I feel like your loved ones would kind of want to have you foster your own path and just kind of be there to lend support if that was the case.
That's what I would hope as well. I would hope they wouldn't guide me a specific direction, and that my free will would allow for such paths to just pave their own way.
And you mentioned the idea of there being an entity, being something that would help kind of guide people over to the other side too. And that's something that I've always been fascinated with. There's always been the idea of the psychopomp. I don't know if you're familiar with a psychopomp.
No, not.
So a psychopomp is essentially a being from Greek mythology that would be the one who would ferry people who had just died into the other side.
Gotcha.
So it's kind of like when you pass on, this entity, this being, this Greek being would, I don't know how they fit in the realm of the gods. They weren't quite gods, but they would it would be their job to bring you to the afterlife, whether it be good or bad. So they would be the ones that would they didn't lend judgment like we think that our gods and angels do now, but they would kind of talk to you about your life as you were transitioning into that next world. And I think that that's going to fit in with tonight's guest, because we're going to be talking about people that are passing away in hospitals and in medical facilities, and I'm sure that a lot of these beings that might be around them might fit into that same mythology of psychopomps.
Absolutely, and as always, it has been a pleasure.
Yes, and you have a great night, and we'll talk to you in a couple weeks because we're not going to be on next week. So,
and good luck next week at the convention, both you and Stephanie.
Thank you very much.
You're welcome. Bye, guys.
Have a great night. That is our paranormal news correspondent, Melody Knapp. She joins us to give us the Week in Weird, and if you follow along with Spooky South Coast on social media, if you follow us on Facebook, on Twitter. We share these stories all week long, and you can comment on them, and we'll work your comments into Melody's reports as well. So that's the easiest way to follow along with our stories, is just by following us on social media, and you'll see the stuff that we are posting. And I don't know, I've always been fascinated with the idea of psychopomps. I had an idea a couple of years ago to write a book about them and kind of talk about how the concept, even though Greek mythology hasn't really survived, we kind of look at it as being an archaic belief system now, and now we have a lot of focus on monotheism, so we don't give credence to a lot of these other types of beings. But I think that there are still a lot of those stories out there. There are, except now instead of it being some strange being that shows up to foster you on your trip to the other side, now it's your past loved ones who come around and who are standing around you as you are on your deathbed, and who are waiting to carry you over to the other side, or to cross you over and guide you over to the other side. So I think that would be a big part of what we'll be talking about in just a few minutes with our guest, Dr. Scott Kolbaba. But there's other weird stories that are associated with it as well, too. And what I find interesting about this is we're talking about the medical field. We're talking about people who are coming from a scientific background, that maybe they went into this with one mindset, but the work that they do takes on such a spiritual aspect that they can't help it. They can't help but start to believe in this stuff. And so the more that they do, and the more that they open themselves up to that, the more they're probably realizing the things that are going on. And that, I think, we'll get into that for sure with Scott in just a few moments, but I feel like that is the big aspect of this, is how does having we can talk about all these stories, and we can talk about how interesting it is, and how just collecting these stories and hearing these stories is going to change the way that we look at death and everything like that. But how does it change the medical professional? How does it change the person that is watching other people have these experiences? That's what I think is the most fascinating part about this. And that's what we will certainly talk about coming up in just a few minutes. And if any time during the show you want to call in, the number is 508-996-0500 or 877-996-1420 if you would like to join in. And I'm seeing some people are already sharing some of the Provincetown Paracon posts. You can do that. Just remember that when you share the Provincetown Paracon posts, tag me in it. Make sure you tag me in the post or at least in the comments. And then that way there we can enter your name into the drawing that will be happening on Wednesday night. And Sam gave us a bunch of tickets to give away. He was very kind to donate a whole bunch of them for us to give away through the show. So like I said, we'll give away some later on tonight, but then we'll have a couple pairs to give away on Wednesday night. So, definitely make sure you keep sharing. And it's not a one-time only entrance type of thing. You can put it in as many times as you want. As many times as you want to share it and tag me in it. I'll try and make sure that I keep up with all of them and make sure that you have the adequate number of entries that will literally go into a hat. Because I have a hat in the trunk of my car that I will put them into. And Corey, I love you, Corey. You're trying to figure it out, but you're just tagging me in other people's posts. You got to share the post. There he goes. He's got it now. There we go. All right. And so we already have people sharing the post, so that's good. Already have entrance for the Provincetown Paracon tickets. Matt, are you going to enter? I know normally you can't enter, but if you want to enter, I'll let you enter. Or you can just have Saturday night off next week. Either way. But if you want to go down to Provincetown, it's a little bit of a hike, but it's worth it. And I should turn the microphone on.
It's a nice ride.
It is. It's fantastic. You'll be there right before the start of the season. You'll have the entire Provincetown. We'll have the entire Provincetown to ourselves. So it'll be a great time. So even if you don't win, make sure you get tickets because you're going to want to come down and party with us. Especially you want to party with Stephanie and I because ain't no party like a spooky South Coast party. But the spooky South Coast party does stop.
Does it?
At some point we get tired and we have to go to bed.
Right.
Yeah, we're not as party animals as we used to be. All right, well, let's get into the discussion tonight with our guest. Dr. Scott Kolbaba is an internist in private practice in Wheaton, Illinois. He graduated from University of Illinois College of Medicine with honors and did his residency at Rush Presbyterian St. Luke's Medical Center in Chicago and at the Mayo Clinic in Rochester, Minnesota. He has been awarded membership in the Alpha Omega Alpha Honor Medical Society and has been featured in Chicago Magazine as a top doctor in internal medicine. And he joins us on the line right now. Let me lock him in here. Good evening, Dr. Kolbaba. You with us?
Yes, I am, Tim.
Great to hear from you. How are you doing?
I'm doing good. Thanks.
Well, my first question is, with you being a doctor and all, does this look infected?
Does this look? What did you say? I'm sorry.
I said, does this look infected?
I don't think so.
I figure you probably have to deal with that a lot. I
think you're okay.
We have to go and hear, whenever we go anywhere, we have to hear everybody's ghost stories. I can only imagine what it must be like as a doctor to have to hear everybody's medical ailments and problems.
Well, I love what I'm doing, and I've always wanted to be a doc, and I've been doing this for about 35 years, and I hear all kinds of ailments and try to do some good occasionally.
And it seems like, being a doctor, as I was talking before, as Matt was getting you on the line, I don't know how much of it you heard. I would assume that you spent a lot of your education, at least, and a lot of your life, very based in science and very based in factual and empirical data that you could look, see, hold on to, research. I'm assuming that you entered into the medical field with that type of a mindset.
Exactly, and everyone does. And what's so interesting about the stories that I've run across is that they are not based on science. These are things that the doctors couldn't explain scientifically. And when I started researching this book and I talked to about 200 doctors, interviewed them, and I said, one of the questions I asked was, have you had any experiences you can't explain scientifically? And lots of them did. And I included the ones that gave me goosebumps or made me tear up with emotion to be part of the book.
And the idea for the book must have come from you having your own experiences in that regard.
Yeah, it did. I had a few really interesting and strange experiences, and then for some reason, doctors started to come to me with their experiences that they hadn't talked with anyone about. And after collecting about 4 or 5 of these, I thought, I've got to write these down. These are just amazing experiences that they don't talk about, and doctors don't talk about this stuff.
I find that very interesting because you would think that when you are working in that field and having these experiences, probably the only other person you could talk to and get this off your chest and discuss this with would be another doctor that has had a similar experience.
Right. Yeah, you'd think so, but doctors, we're actually pretty superficial. We talk about serum potassium levels and whose gallbladder we had to take out and those kinds of things, and very rarely do we get into some of this deep spiritual stuff. And it was interesting for me to really learn a lot about the docs in talking about these stories. It was a really an eye opener, and I think the docs don't talk about it because they're afraid that if they do, they'll be criticized and made fun of. You saw a vision, you had a dream about a patient. Those are things that aren't scientific and aren't supposed to happen, but they do happen.
And I don't know how much of this would be something that would be a discussion you would have, on a day-to-day basis with colleagues in the field, but maybe in the research for this book it came up. Do a lot of doctors maintain a spiritual belief, or does the work and what you have to go through on a day-to-day basis kind of affect whether or not you can believe in there being something beyond this world?
I think a lot of doctors have a very deep spirituality. I was surprised about that. Many doctors don't belong to an organized religion, don't go to church, but they are very deeply spiritual. And I was literally shocked that some of these doctors, who sometimes were a little crusty and doctors that didn't seem to be spiritual, really were. And it was a real eye opener for me to see some of the doctors and the stuff that I learned about them and what they did on the side, and helping people and contributing to doing prayer sessions with kids in jail and things like that. It was mind-boggling and mind-expanding.
Because, as a doctor, you have people who are in dire situations and things take a turn for the good, and everybody will talk about, it's a miracle. It's a miracle that this happened. And sometimes I feel like calling it a miracle kind of shortchanges what the medical profession has been able to do for you. But at the same time, there also has to be that power of faith and belief and positivity, at least, just to help you carry yourself through the process emotionally. Even if the power of positivity isn't a real thing, even if it can't have a physical effect on you or what's happening, at least staying positive helps you to stay in the right mindset to get care.
Well, we always see the things that surprise us. When a person suddenly turns the corner and you thought they were dying and they don't. I just had an individual we sent to a nursing home in hospice to die. He had multiple pneumonias. This is like his 3rd pneumonia that he had in the last maybe month. And he was going downhill. He finally said, I've given up. I don't want to live anymore. His family agreed that he'd been through so much and it was just time to let him go. So we stopped all of his medicine. We sent him off to a hospice program in a nursing home. And about a week later, he was hungry, eating, and back to his old self. So, we run into these situations all the time. And sometimes if you're negative, things don't work out as well. I think you have to maintain the positivity in medicine because these things do happen.
When you were getting involved in medicine, in the early days of your studies, did it take a lot of... Was it hard for you to kind of play into other people's beliefs? As paranormal investigators, one of the things that we have to deal with when we go into helping somebody with maybe a haunted location is we have to take their belief set into account. So we can't just go in there putting out our own theories of everything. We have to take into account what their spiritual beliefs may be. Did that also enter into you in treating patients, that you had to kind of take into account where they were coming from a spiritual basis?
It's almost never. And that's one of the reasons I wrote this book, and that is we almost never get into the spiritual realm with patients and talk about their belief system and so forth. And I think that play such a big role in healing and helping people recover from an illness. And doctors are hesitant to talk about that. Patients rarely bring it up. I think in the last 30 years, since I've been in practice, I've had a handful of people that have talked about their spirituality. And I think it's a very important aspect of healing and taking care of people, and that's one of the reasons I wrote the book, to open up that channel so that doctors feel more comfortable and patients feel more comfortable talking to doctors. And so they realize that doctors do have a spiritual side to them that's sometimes very deep and profound. And I think if patients and doctors talk to each other about their spiritual beliefs, I think we can accomplish a lot more than just what we do with pills and IV medications.
But do you think that kind of the prevailing mindset from other people, and the reason why they don't talk about it, is maybe because they want to see the doctor be detached from that? They want to see the doctor be more based in empirical science and more based in results that can be shown instead of things that have to be believed?
I don't know if they want to. I think they think that doctors are so scientific that to bring up something spiritual would be scoffed at. I think that's the real reason. I don't think they know that doctors are as spiritual as they are. And again, that's one of the reasons I wanted to bring out some of these stories.
Well, for yourself, I mean, I assume that there was probably some things that happened in the course of your career where you started to feel this way, but was there anything in your life before becoming a doctor where you thought it might have been something strange, unexplained, paranormal? Did you ever have any of these type of experiences before becoming a doctor?
You know, I can't think of a lot of experiences, but you know, when I think back, I've had some strange coincidences that have happened to me that I thought were coincidental, that really weren't. I'm convinced now, after writing this book and talking with the doctors, that really weren't coincidences. And I can tell you a few if you're interested.
Oh yeah, absolutely.
Yeah, the most significant one was before I became a doctor. I was actually an economics major in college, and I was trying to get into medical school. And I had a family by this point, and I really had only one more year that I was going to give myself to get into medical school and take the prerequisites. And one of the prerequisites I needed to get was organic chemistry. And I had a job. I was working full-time during the day, and organic chemistry was offered at night in the same town that I was living. And so that was great. I was able to, enroll in that class. I showed up in the bookstore, bought a book. There were about 3 shelves of books in the bookstore. I went to the class for the first night, and there were about 3 kids in the class. And the professor walked in, and I thought, boy, I'll be able to get some personal attention. The professor walked in and said, we're canceling the class. There are not enough students. And I was heartbroken because I thought this is the end of my career. I'm never going to go into medicine because I will never be able to get organic chemistry, and I've got to get a real job and get on with my life. But I discovered there was another class in downtown Chicago, which is about 70 miles away. So the next day I drove down and I waited in the line to register for the organic chemistry class at night. And by the time I got to the front of the line, the registrar said, I'm very sorry. We have one class that's totally filled. The next class we opened up just because we had such a demand. Now we have 10 or 11 students that are on the waiting list for spots, and you won't be able to get in. And I was just heartbroken. So I said to the registrar, who makes the final decision on allowing people to get into the class? And they said, the professor does. So I said, where can I find the professor? And then she said, we'll go to the 3rd floor, room 301. So I ran up the stairs, stumbling probably half the way. And there was a whole room of students there trying to get into organic chemistry. And I must have looked like a real sad sack to the receptionist there. And I said, if I can just talk with the professor for just 2 minutes. And she said, okay, go ahead and wait in the anteroom. And much to the consternation of all the students that were waiting, I walked ahead of everyone. And I sat in the little anteroom outside the professor's office. In the office, 2 professors were talking about one of the problems they were having, and that is they'd opened up a class, they had no books for the class. And what they had done was called a publisher. They searched all the local schools, and no one had any organic chemistry books. And I heard the conversation. I don't think I was supposed to hear the conversation, but the door was so thin, I was sitting outside, and I heard everything they were talking about. And then the one professor shook the hands of the other one, and one walked out, and the other one signaled for me to come in, and I told him my sad story that I needed to get organic chemistry, otherwise I couldn't get into medical school, and I'd be a failure in life and so forth. He said, I'm very sorry, we have 2 classes that are filled. We have 10 on the waiting list, and you just can't get into the class this year. And so I realized this was a desperate time, and I needed a desperate measure. So I said to him, if I can get you books for the class, will you let me in? And by this point, my heart was in my throat. It was pounding like crazy. And all of a sudden, he became suddenly very interested, and his eyebrows went up, and he looked at me, and there was a long pause. Well, he looked at me, and he said, could you get me 30? And I waited for a second, and I said, more. And there was a long pause, and by this point, my heart's way up in my throat, and this is my life flashing in front of me. And after the longest pause, it seemed like hours, he said, you're in. I told him where the books were. They got the books for the class. I got into organic chemistry. And I thought for the longest time that was just a strange coincidence. That I happened to be there at the right time in the right spot, and I was the only one that could help them, and they were the only ones that could help me. But in thinking back, I think that was more than a coincidence. I think there was something that directed me to that place at that very time when I could help them and they could help me. And that otherwise, I wouldn't have been a doctor. I wouldn't have gone into medicine. That was the end of my career.
Well, I mean, I guess that's certainly something kind of intervening. Was that, though, a situation where, I mean, I'm sure there's been multiple times in your career where you did have to kind of give into faith a little bit and to think that, listen, I just got to trust that things are going to work out. I just have to trust that all I can do is what I can do, and then whatever else happens is placed in the hands of whatever, whether you want to call it God or fate or destiny or what have you. You kind of do have to give yourself into this higher power at some point.
Yes, and I didn't realize that until I wrote this book, that was probably more than just a coincidence, that was probably a higher power that was helping and guiding me to get into this career.
So now once you're in the career and you're going about the work, and again, keeping a very scientific approach to everything, at some point there must be some little story, or at least there must have been at least one turning point where you said, okay, there's something more to this. There's something else that's kind of guiding things along here. Yeah,
and there was, and the one story that really got my attention and really touched my heart was I was taking care of an individual who was traveling. I think he was in Arkansas or Alabama, and he was traveling, and he called me up from down south, and he said, I've got this abdominal pain, right upper abdominal pain. I'm nauseated. I came after I was eating, and I'm really sick. And he said, what should I do? And I said, well, you better go to the emergency room. And so he went to the emergency room, and about 2 hours later, I got a call from the ER doc. And he said, I'm seeing your patient here. He's got abdominal pain. It sounds like gallbladder, but we got a gallbladder ultrasound, which is normal. His labs were normal. We gave him some narcotic medication. He's fine now, so we're sending him home. But, he'll want to see you when he gets back to Chicago. So a couple of days later, he was in the office, and I was seeing him, and it sounds just like gallbladder, right upper abdominal pain, nausea, following eating, and I got some fancy gallbladder tests and some additional blood work. Everything was normal. And as you know, one of the things that's real frustrating for doctors is if you have a patient that's reasonably sick and you can't diagnose what they have, it's very, very frustrating. And I think I saw him again one time in the office and still having this abdominal pain. But we had gotten a number of other studies, and everything was perfectly normal. And a couple of days later, I woke up in the morning, and I had this overwhelming feeling that he needed a lung scan. Now, it didn't make any sense with abdominal pain why I would get a lung scan, but I just couldn't get it out of my mind. And I called him up, which is unusual. That I would call a person up at 7:30 in the morning and say, listen, I just woke up with the idea that you needed a lung scan, and I know it sounds a little strange, but I think we need to do this. And he said, well, I can't do it today because I'm flying out to Denver, and I'll be busy and running around getting packed and so forth. And I said, what time's your flight? And he said, 2:00. So I said, if I can get the lung scan in first thing in the morning, will you go for it? Well, if we can get in fairly soon. And he said, it was a long pause, and finally he said, yes, I'll if you think it's important, I'll do it. So I called the radiology department, and I said, I need to get a lung scan in. And they said, well, the next one we have is 2 days from now. And I said, no, I need one urgently. And finally, after much pleading and arm twisting, he said, okay, just send him over. So Taylor went over to the X-ray department, got the lung scan. About an hour later, I get a call from the radiologist, and he said, nice call, Scott. And I said, what do you mean? And they said, well, it's a nice call ordering that lung scan. He had a massive pulmonary embolus, a blood clot in his lung, sitting on the diaphragm on the right side, which is why he had abdominal pain and not chest pain. I got goosebumps because that was really, really strange that this was a life-threatening condition. Had he flown out that day, I put him right in the hospital, but had he flown out that day, he probably would have died because he would have had other blood clots, and it probably would have been fatal. So that got me thinking there's something else that was working here other than just pure science, and I couldn't get that out of my mind. And that's kind of what started me thinking that I wonder whether other doctors have had similar experiences. And about that same time, 2 other doctors came forward with experiences that they had that were really unusual and strange. And I thought to myself, I'm going to start writing these down and see if I can make this into a book. And so I started interviewing other doctors, and I was shocked that lots of doctors have had experiences that are really unusual, strange, that they can't explain scientifically, but they don't tell anyone. And I included the ones that really touched my heart in the book. But there are lots of other stories that were minor stories that don't give you goosebumps. But I was amazed at the number of stories that are out there that we don't talk about.
So did you get the feeling like with those experiences that it might be some kind of a medical intuition, some sort of something that was from within you and the other doctors that had similar experiences, some sort, I don't want to call it psychic, but some sort of just extra perception that you're able to pick up on? Or do you feel like you were being guided into making those decisions by an outside force?
Well, you can say that I've got a lot of experience and maybe this was my intuition and so forth, but I think it was something else. And some of the doctors have had experiences that were totally not related to intuition at all. One of the initial stories that I heard was a story from Dr. Steve Heim, who was an orthopedic surgeon and a trauma surgeon who was skiing in Colorado. And he was skiing with his wife and his wife's sister. They got up on top of a big mountain that they were going to ski down. A blizzard hit at the time. They could hardly see anything in front of them. And the temperature dropped. The snow was coming down like crazy. They had to ski down the mountain. And they came to a grove of trees right in the middle of the path that they were skiing, and they had to go right or left. And Dr. Heim went to the right. The girls went to the left. And as soon as Dr. Heim realized that, he wanted to get back to where the girls were, so he was skiing through the grove of trees. And all of a sudden, he had a strange experience. He felt like something dreadful was happening. Everything became very quiet and very, very silent. And he could hear his breath. He could hear the snow underneath his skis. And he felt that he had to stop skiing and do something. So he stopped skiing. He had no idea what he was doing. He took off his skis, and then instead of walking toward where the girls were on the other side of the grove of trees, he started to climb up the mountain in the opposite direction from where the girls were waiting, and they were still waiting for him. So he's climbing and walking and climbing and walking, still having this feeling that he's being called upon to do something that has life and death implications, and he has no idea what it is. In the meantime, the snow is coming down like crazy, and it's still silent all around him. He can't understand why it's so quiet all around him. He came to a big pine tree. Now there's 5 feet of powder snow, around a pine tree, in any tree, there's a thing called a tree well, where the snow comes down to the base of the tree. So it's very shallow at the base of the tree, then it goes up to 5 feet. And he's standing in front of this pine tree, still not knowing what he's doing, until he looked down, and then he knew why he was there. Under the tree was a body covered with snow. He brushed off the head, and the fellow looked like he was dead. He must have hit the tree. He had a gray face. He couldn't see that he was breathing. But Dr. Heim is a trauma surgeon. What better person to come across a skier like this than a trauma surgeon? So he put his hand on the carotid artery in his neck, and he felt a pulse. He was alive. So he went into trauma mode, put his head down, brushed the snow off, covered him with his jacket, started yelling for help, help. One of the last skiers down the mountain heard his cry for help, came to him. He said, what can I do? And he said, go on to as soon as you get to a phone, call the ski patrol. About 20 minutes later, a snowmobile pulling a gurney came up with the ski patrol. They loaded this unconscious hypothermic skier onto this gurney, took him down to a waiting ambulance at the lodge, and took him off to the hospital. In the meantime, Dr. Heim was shivering because he took his jackets off, and he put his jackets back on, made his way back to the girls who were still waiting on the other side, and they all skied down the mountain. The next day, he called the hospital to find out what happened to the skier, and they said he's fine. He woke up. He's perfectly fine.
Wow.
He did a wonderful job. They said splinting his broken leg in the field with a tree branch and some underclothes, and everything turned out well. So that was an experience that he could. It wasn't really a medical cure or anything like that, but it was an experience that he had that he just couldn't explain, and all he could say was that I was directed by someone from above.
Right, and that's got to be the end result of that. Is you've got to feel like not only was it he was guided to find that individual, but almost like that individual's miraculous recovery was almost like his reward for listening to that voice, for listening to that whatever was drawing him toward that person.
Yes, yeah. It's interesting too that about 2 years before, Dr. Heim had an experience in the mountain very similar, where his father, who was cross-country skiing with him, arrested and had a heart attack. And Dr. Heim rushed him off. He's a real strong guy. He rushed him off, picked him up and carried him, rushed him off to a first aid station. And they did CPR for an hour, and he lost him. His father died. And Dr. Heim couldn't forgive himself for losing his father. He's used to saving people, not losing them. And he felt guilty that this was his fault. And when he found this skier on the mountain the second time, he was not only able to save the skier's life, but also he realized that he felt this was his second chance, and he did save the skier, and he felt that this was God's way of telling him that when a person's time is up, his time is up, and he was given a second chance to realize that and actually save a life.
It's really fascinating when you can almost feel like you were, and this is something that I'm sure as medical professionals you go through every day, but to feel like, you had a hand in essentially changing the fate of somebody, essentially taking what was supposed to be their destiny, and it was your destiny to interact with them and to cross paths with them and to be able to alter the course of that. It's a pretty powerful thing, and I can understand. They always talked about how some doctors get a little bit of a God complex. You can understand that because you are altering the fate of somebody's life, the course of somebody's life.
Most of the time we deal with sore throats and diarrhea and things like that, but there are occasions when we run across an individual or a family or something that we really can make a difference, and that's what makes you go on and put up with the long hours and the troubles and so forth, that you really can make a difference. And I think occasionally we are helped by God, by whatever you call that force. You can call it whatever you want. Most of my doctors call it God. That I think works through us on occasion. It works through everyone.
But at the same time, though, we regular people, lay people are talking about how they feel like they are challenged by God sometimes, and I'm sure medical professionals feel like they're challenged by God on quite a frequent basis.
Mm-hmm. I think you're right.
Well, we're going to get more into this coming up. We do have to take a break in just a few moments for the news. We do the network news here for a few minutes, and when we come back on the other side, we'll get more into the discussion with our guest, Dr. Scott Kolbaba, about his new book. It's called Physicians' Untold Stories, and if you want to get the book, you can get that right on the website. You can go to physiciansuntoldstories.com to find out more about the good doctor, to find out more about the book, and to get some more some of the stories that are shared there as well. But we're going to share some of those stories coming up in the next hour. We're going to talk about things like near-death experiences. We're going to talk about things like visitations and people who come to help other people cross over, and some of the other strange things that have come up in the course of the medical field over the years. But just in like the 2 minutes that we have here, Doctor, I do have one question that came up in the chat room that I wanted to ask you. We were talking about medical intuition a few moments ago, and does it ever feel like sometimes like some things you do just become intuitive because you've done them over and over again, that you kind of can just tell what something might be, that you just get this feeling and you go with it?
Oh, sure. And that happens almost all the time. When you see a patient and you talk with them and you get their history and do their exam, you have an intuition, you have a feeling about what the diagnosis is because you've seen it before. And we do that every day with virtually every patient. But there are some situations where it seems to be more than just education and intuition, and that's what we wrote about in the book.
And even with that intuition, that's just the beginning stage of things. You're still following up and doing all the testing to make sure that your intuition is correct.
Oh, for sure. I mean, we have you have a differential diagnosis when you see a person. Person comes in with chest pain. A differential diagnosis would be a heart attack, blood clot in the lungs, musculoskeletal things. So there's a number of things that go through your mind in a differential diagnosis, and you have a hunch or intuition as to what the most likely thing is based on your experience, and so that's how we diagnose medical conditions all the time.
All right. Well, we'll get more into this coming up again in the next hour. We are going to take a break for the news. If you want to check out the doctor's website during the break, it is physiciansuntoldsstories.com. Matt has it up on the screen, up on SpookySouthCoast.com, and we have it all up on our social media as well, so you can check it out for yourself. And when we come back in the next hour, you can also call in with any questions or stories that you want to share with us at 508-996-0500, 877-996-1420, or in the chat room at SpookySouthCoast.com, or you can tweet them to us using the hashtag SpookyLive, or email as well, spookycrew@SpookySouthCoast.com. Many different ways to get involved with the show, but of course, we love to hear the sound of your voice. So 508-996-0500, 877-996-1420 are the numbers to call in if you have a question for Dr. Kolbaba. When we come back with more Spooky South Coast, coming up following the news, it's Saturday night, so you know it's time to be spooky. We'll be right back. Number 2 of Spooky South Coast. Tim Weisberg here, along with the silent assassin Matt Costa. Stephanie Burke is at Mount Washington right now with Strange Escapes. They are there for the Mount Washington event up there. Stephanie is using an actual Frank's box tonight, a real Frank's box that Frank made himself. I'm pretty jealous of that. And they're having a good time up there. But we are having a good time here as well. And as I mentioned, next week we will be at the Provincetown Paracon. Stephanie and I will be presenting together there. And we'll also be giving away a pair of tickets later on, maybe 2, to the daytime Saturday portion of the Provincetown Paracon. And we'll be giving away some pairs later on in the week as well. All you have to do to win them during the week is when you follow Provincetown Paracon on social media, follow them on Facebook. That's the best way to do it. And take some of those Provincetown Paracon posts and share them. And tag me in them. Tag Tim Weisberg in them when you share them. And then on Wednesday night, I'm going to have a list of everybody that's shared it and how many times they've shared it. And I'm going to write everybody's name down, and I'm going to cut it all up. I'm going to put it into a hat. I'm going to go on Facebook Live. I'm going to mix around all the names, and I'm going to pull the winners out of the hat. So you literally have the chance to have your name pulled out of the hat to win tickets to the Provincetown Paracon. So between now and Wednesday night, the Wednesday night cutoff will be at 8 p.m. because then I should be done with all my work in the news department. And then we'll put all the names in the hat, and we'll do it on Wednesday night at 8 p.m. So between now and then, share as many of those Provincetown Paracon Facebook posts, tag me in them, and you will be entered each time. You will get an entrance to win those tickets to the Provincetown Paracon. But we'll also be giving away some tonight, so stay tuned to the show in its entirety because we'll have a trivia question coming up for you at the end of the program. And now we're going to get back into the discussion with our guest tonight, Dr. Scott Kolbaba. We are talking about his book, Physicians' Untold Stories. And you can also check him out on the web as well. That is the name of the website as well, physiciansuntoldstories.com, if you want to go there and purchase the book and find out more about the good doctor who is coming back with us now. And thank you for holding during the news. I know that doctors, when they're used to a very fast-paced environment, and we try to keep things pretty laid back here, but we have to take the break for the news. We have to let the people know about what's going on. So thank you for holding on, Doctor.
Totally understand, Tim. By the way, my wife was born in New Bedford.
Oh, really?
Yes.
That's pretty coincidental. And at St. Luke's Hospital?
This was a long time ago. I'm not sure what hospital it was, but she was born there. We go back to Cape Cod every once in a while and drive through New Bedford.
Oh, that's awesome. Well, that's Matt Costa, my co-host, and I were actually from Wareham, from the gateway to Cape Cod. So
my goodness, that's where she lived also, Wareham.
Oh, wow, that's awesome. Small world.
It is.
And so, but now you're out in the Chicago area, right?
Yes, we are. Yeah.
And I know that just like we have in Boston here, there's a great medical community out in the Chicago area. A lot of groundbreaking research is done, and a lot of some of the top doctors in the country are located right there.
Right. We have a number of medical schools here, and it's quite a medical community.
And I guess when you have that type of community, it probably fosters a lot of, as we were talking earlier, like-minded thinking, where a lot of doctors are tuning out the fact that this stuff can happen, that there is this greater power at work. But as you said, you started to hear some more of these stories. And obviously, whatever the process was for collecting these, we'll get into a little bit. But since the book has come out and since you've been out doing media, have you had more doctors that have been coming up to you and sharing with you stories and saying, hey, I had something weird that happened?
Yeah, there's some interesting things that have happened since the book has come out. The first thing that's happened is, the doctors that share their stories were a little anxious about whether they would be criticized by patients, by other doctors, and so forth. And just the opposite. They've been heralded as people that have taken a lead in opening up the door between patients and physicians and discussing spirituality. So. And then one of the doctors, interestingly, that wanted to remain anonymous, the only one doctor wanted to remain anonymous in the book. And after we launched the book and he saw what laudits the other doctors were getting, he said, I don't want to be anonymous anymore. Put my name in and let people know who I am. So, and then what's also happened is we've gotten a number of other doctors that have written to me or communicated with me about their stories. And they want to, come forward with some amazing stories that they've had.
See, I'm a journalist by trade, and I've spent the last 11 years hosting the show, and I had to kind of ease into asking people about strange and unusual experiences. I've had to find a way to kind of ease into working it into conversations, and eventually I've reached the point now where, I have no problem just walking up to somebody I've just met and said, hi, I'm Tim. Hey, you ever have any ghost experiences? I'm sure that it didn't work so well for you in trying to collect these stories for the book, that you had to kind of broach the subject gently to a lot of doctors, and also it probably took a while to collect some of these stories.
Yeah, it took me about 3.5 years to write the book. It was supposed to be a 6-month project, but I had a couple experiences myself, as I mentioned to you, and then a couple of other doctors just spontaneously came to me with their stories. But what I did to collect the rest of the stories was to hang out in the doctor's lounge. And the doctor's lounge has all kinds of wonderful things that attract doctors, like donuts and coffee and things like that. Occasionally there's some good stuff like oatmeal and fruit. And I would go to the doctor's lounge early in the morning, probably 5:30 or so in the morning. And then any doctor that would come into the doctor's lounge, I would ask them if they had any experiences that they couldn't explain medically. And no one seemed to know exactly what I was talking about, so what I would frequently do is just tell them a story to give them an illustration of what I was looking for. And then they would say, oh, yes, I've got this story. And we talk a little bit about it because everyone's pretty busy in the morning trying to see patients before office hours and so forth. And then I would take their telephone number and call them sometime that week and get the details of the story. And we'd go back and forth like that for a number of sessions to get the story completely right. And then when I finally finished the story, I'd send it to them and say, proofread this, make sure that this is all completely accurate because it's such an amazing story. No one wants to exaggerate because the story is phenomenal enough in itself. So that's how I did that. And again, there were lots. I probably interviewed close to 200 doctors lots of doctors had stories, but again, I picked out about 26 of the stories that I thought were the most special, that really touched my insides, and I put those in the book.
And I'm, with the book, you're looking for a variety of stories, but I'm sure as you were collecting these stories overall and collecting, over 200 stories, there must have been some thematic elements that came up. What was probably the most common type of experience that doctors were having?
These were all very different experiences, and I tried to avoid miracle cures. I have about one or two miracle cures in the book because I think those tend to be a little bit boring after a while. And the stories that I collected were stories that I thought where doctors were touched by a divine hand, where they had some experience that it just defied scientific explanation. And I think, when you assemble a group of stories like this, you never know, at least I didn't know, what the bottom line was, what the final theme would be of the book. I just assembled these interesting and fascinating stories. And there are a couple of themes that I think that came out. One is a theme of love. Love seems to be, from the stories that I collected, one of the most powerful forces in the universe. And love can transcend time and eternity and everything. So the love of family members was a big theme. I think the other theme was that there's something else out there. There's a force out there that guides us and helps us to do the things that if we set our mind to do something, we will frequently, and doctors experience this, will frequently be guided and helped in strange and wonderful ways to accomplish those incredible goals. And I think one of the other themes was that people that have passed, friends and relatives that have passed, can sometimes communicate with us and help us in the things the good things that we're trying to accomplish. So those are some of the themes that seem to come out in the book.
Well, I noticed, in just talking with people myself, and as I had mentioned earlier in the show, one of the thematic elements of literature and of early mythology that fascinated me was the idea of a psychopomp. These beings that would come and would ferry the dead to their final destination. They'd be kind of the guiding hand that would lead people, whether it be to heaven or hell or the Greek mythology equivalents. It would be somebody whose job it was to ferry them to the other side. And I know that in talking with a lot of people who have been around loved ones who have passed in hospitals, there's always reports of loved ones who have come back to help them, loved ones who have appeared to them as they're dying, seeing that white light, seeing that tunnel appear before them as they're breathing their final moments. And I wonder if there's ever any time when the patients are experiencing this, if the doctors are experiencing some sort of version of that phenomena themselves at the same time.
Well, the patients report these kinds of things, and I've had a number of ER docs where you find lots of people that have arrested or come back from a death experience, and it's in the literature of the ER physicians that this is not an uncommon thing that happens, and we've had a number of doctors give me stories about these kinds of things. I'm just trying to think of one. Fred Bohofer is an ER doc in our emergency room, and he had a case where a person, a fellow in his 50s, came in to the ambulance, through an ambulance, who arrested in the ambulance, and they were doing CPR. He had to shock them back to life, and as soon as he administered the shock, his heart started again. He was in ventricular fibrillation. Came back, was awake for a while. Then as they wheeled him into the ER, he arrested again. They shocked him one more time. And then he was okay for a little bit as they wheeled him into the room, the heart room in the ER. He arrested again, shocked him back, and then they administered medications and so forth that kept him from arresting. And when he came to and was awake and reasonably alert, Dr. Bohofer noticed that he was unusually calm, and he said, you just had some real serious things happen to you. Are you okay? And he said, yeah, I really feel very, very calm about the whole thing. And he said, when I first arrested, I saw my father. It was very much, very lifelike, and it was as if I could touch him. He came to me, and he just stood there. He didn't say anything. And then the second time I arrested, he was joined by my wife. And then the third time, my brother came too. So there was my brother, my father, and my wife standing there, and they were just so real. I couldn't believe it, and they were a very calming influence on me, and I knew that I would be okay whatever happened to me. And Dr. Bohofer said, "Well, that's really nice, and I'm glad they provided some comfort to you. Will they be visiting you here in the hospital where you'll be in the intensive care unit for a little bit?" And he said, "No, because they've all died in the past." So obviously they had. I think his impression was that they had come to from the other side to take this individual back had he not survived the arrest. But he did, and he lived, and it was very calm because of the influence of his deceased relatives. And Dr. Bohofer said, I've read this a lot in the medical literature, that this thing is not unusual. This kind of thing happens all the time.
Well, I know that physicians will obviously study Elizabeth Kubler-Ross for the 5 stages of grief and for that aspect of things. But from a paranormal perspective, a lot of us will look at her work with near-death experiences and the work of Dr. Raymond Moody. Are these theories, are these stories that they discuss? Is this something that the medical community talks about as well?
Yeah, we do. And there are, obviously there are stages of grief, but there are experiences that doctors have had with patients dying that are really unusual and strange. And we had one doctor, John Saran, who was a general internist, who had a neighbor that was dying of colon cancer. And when he was near terminal, he mentioned to his wife that I'm seeing 3 girls dancing in the living room, and his wife didn't see them, and she said, "Well, tell me about them." And she said he said they're all dressed in white, they're dancing, they're very young girls, and seem to be very happy. And she suddenly realized what was going on here, and she said to him, these are angels that have come to take you back. And he accepted that. He said, he said to her, "I'll take care of things on the other side if you take care of things on the earth for our family." And she said, I would do that. And he then closed his eyes and died. And so she was convinced that these were angels that had come to take him back.
I think that's a comforting thought for a lot of people to think that there is someone who is going to be there for us. Obviously, we want our loved ones, our living loved ones around us when we die, but it's still the scary experience of going on to some unknown. So it's beneficial when somebody can come back and be there for us. So I'm not surprised that a lot of people see loved ones around them or angelic beings around them as they're passing. The white light has always been something that I've been fascinating with. When people have near-death experiences in their report, seeing this light. And, as was mentioned in the chat room, some people think it's, indicative of the birth canal and giving an argument to reincarnation. But I have a friend who actually had died, and they were able to bring him back. But during his death experience, it was not a bright light and loved ones. It was actually very negative, very traumatic, and he felt like he was essentially going to be tortured for eternity in just a few minutes that he was no longer with us. Do you get reports of that from people who have passed? And is there any kind of physical sign that they are going through something? When I know, obviously, when somebody dies, you're working on reviving them, but is there any kind of physical sign that you can see that they've been through something traumatic in those moments?
A cardiac arrest and resuscitation and so forth is pretty traumatic. Most people, when they go through that, are really unconscious and not aware of what's happening to them. But in talking with some of the doctors that deal with death and dying all the time, the palliative care doctors, they are pretty positive that when people are dying, that they almost universally have positive experiences. They have good, hopeful experiences. And obviously, there have been books written about near-death experiences where people were traumatized and they had a very bad experience. But the vast majority of people that are dying, from the people that deal with this all the time. The palliative care doctors tell me that their experiences are positive. They either see loved ones or have some feeling that they're going to meet their loved ones, and it's a positive experience and not a negative experience.
So, I mean, let's just say you're going into cardiac arrest and you don't have a pulse and the doctors are trying to bring you back. The brain is still active, though, at that time, right? For a little bit of time, would
Yes.
the brain instantly? So these things could be something happening in the subconscious. They could be a dream, essentially, that's happening to the people while they're going through this physical stress.
Exactly, and when the brain loses blood supply, it doesn't die immediately, and there are some physical things that can happen, such as a bright light and so forth, that can be explained by a lack of blood to the brain. So some of these things can be actually physical phenomenon that happens to the brain when a person is dying. But when they're brought back, then everything returns to normal. But that can, so it can be explained physically also.
But I'm sure that you've also collected stories and heard stories of people who were out of their bodies and can tell you about things that were happening in the room when they were in this type of a state.
We have, and there was one of the first stories that I heard. As a matter of fact, one of the first stories that actually got me really interested in collecting these stories was an experience that Dave Mokel had, one of my orthopedic surgical friends, and I was making rounds on the floor, and Dave literally ran up to me and said, "Scott, I've got this amazing story to tell you." And I said, "Go ahead, Dave." And he said, "Well, I can't tell it to you here because someone might hear me." I said, "Okay, let's go into a patient room where there were no patients." We closed the door. And he said that we had a mutual patient, Mary was her name, and Mary was going for an ankle surgery. Dave was an orthopedic surgeon doing the surgery. And when they administered the antibiotic to her, she arrested because of an anaphylactic reaction to the antibiotic. No pulse, no respirations, eyes closed, no response to pain. She was dead, basically. They called a code in the OR, and when they call a code, everyone rushes in from the ORs around to try to help out. And one of the fellows that came in was a tech with unusually red hair underneath his surgical cap, and he started to do CPR. Well, Mary is a real big woman, and he wasn't doing adequate CPR, and Dave Mokel, who was feeling for a pulse, couldn't feel a pulse, so he asked him to stop doing CPR and he would take over. Well, after a couple times of asking, the individual wouldn't move away. Dave just gave him a push because in a code situation, that's a life and death situation. He was in charge. He had to make sure that things were done as properly as possible. So he pushed the guy aside. He stumbled away. Dave took over doing CPR. And after administering some medications, Mary came around again and lived, and she didn't wake up until the next day. But when she was leaving the hospital about 4 days later, after the cardiologist had cleared her and everyone else had signed off, he was telling her about some instructions to take care of her ankle. She said, "Thank you for saving my life, Dr. Mokel." And he said, "Well, it's just a team," and he's a very humble guy. It was a team effort. Everyone pitched in, and she said, No, I saw you actually push that guy away with the red hair and start my CPR."
Wow.
By that point, Dr. Mokel got some weak knees and had to sit down because he was thinking, like, how can I explain this? And she mentioned multiple little minutia of the events that happened in the room. Dr. Mokel paging me, for example, looking at the door to see if I was coming, other people where they were standing, and so forth. And he said, "Well, how did this happen?" And she said, when I arrested, I rose, my something transported me to the top of the room, and I was able to look down on myself and see everything that was happening, and in great detail. And Dave asked her a few specific questions, and she was able to answer those questions, and he just had no explanation for it. And she said, when I was there, my grandmother, who had died 20 years before or so, came to me and told me that it was not my time to go, that if I was a good and honest person, that she would save a special place for her in heaven. And but this was not her time, and she'd have to go back. And then she did go back. And it's interesting that Mary was really not a very nice person before her arrest. Afterwards, she was the kindest and most gentle person in the world, and a joy to see in the exam room, and a joy to be associated with. She didn't live very long. She lived probably 3 or 4 more years because of multiple medical conditions. But that was one of the stories that really got me interested in asking doctors about their experiences, and really was an unbelievable experience. She was a mutual patient of myself and Dr. Mokel.
Well, I've had the opportunity over the last few years to work with a television show that investigates abandoned asylums and abandoned hospitals as one of the, as the crux of what they do. And one of the stories that I've always shared with him, or one of the theories that I've always shared with him is, yeah, a lot of people die in hospitals, but there's a lot of positive energy that's expelled in hospitals as well. And for every death, there's a birth, and for every life that goes, there's one that comes in, and that's all going to leave some kind of an energetic imprint in these locations. So it's not always necessarily just the people who have died that cause hospitals to be haunted. But have you experienced stories and heard stories of what could only really amount to being a ghostly experience in a hospital or a medical facility?
Let me think about that. One of the most positive experiences that I can remember was a story about a little grandmother, Grandma O'Hanlon. Jack Heitzler is an obstetrician. He actually delivered 2 of our kids, and his wife, Joan, was delivering their 5th child. And Grandma O'Hanlon was a midwife. She was an elderly midwife. And as Joan was delivering the baby, Grandma O'Hanlon walked into the room and literally, with 2 obstetricians there, herself saved Joan's life. Let me go back and tell you a little bit about Grandma O'Hanlon. She was from Ireland. Her father sent her back because there was a big, brouhaha with Catholics and Protestants, and her father was hiding priests in secret rooms in their house, so he thought it was a little dangerous for her to be there, so he sent her to the United States, where she learned to be a midwife. She was kind of the spiritual leader of the family. She delivered lots of babies. She would also work for nothing if the family couldn't afford her. She'd give money to the poor, and she was quite a spiritual force in the family. When she became older, she couldn't deliver babies anymore, and she went to live with Joan and her mother, Joan Heitzler and her mother. And when Joan was a little girl, she always used to say, if I could make it to Grandma O'Hanlon's lap if I was in trouble, I know I'd be safe. And so when Joan was delivering their 5th child, she had delivered the baby, and then afterwards there was a fair amount of pain, and they had to do some procedures on her that caused some pain. And so one of the drugs that they administer in those days was a drug called trilene. Trilene is administered by a mask. It's a gas, and it puts a woman to sleep so that she's totally unconscious, and then they are able to do their procedures, obviously. So Joan was ready to get the trilene mask and to help with her pain when Grandma O'Hanlon stepped into the room, dressed in a little polka dot dress with a white sweater vest and her hair up, white hair up in a bun, and her old lady shoes. And she stood at the foot of the bed and shook her head. She said, "No, Joan shouldn't use the trilene." So Joan Heitzler pushed her away, and she suffered some of the pain, but was able to tolerate it. But no one realized that Joan had eaten a large meal about an hour before she went into labor. And about a minute after she pushed the trilene away, she vomited the entire meal. Now, had she been unconscious with the mask on, that vomitus would have been into her lungs, and she might have died from that, or had a serious complication of aspiration pneumonia. And Joan said she made it to Grandma O'Hanlon's lap one last time, transcending time and eternity. Their love, their great love for each other, transcended time and eternity, because Grandma O'Hanlon had died 22 years before that.
Mm. See, I don't know. For me, I would think that the last place spirits would want to hang around would be the hospital, unless for some reason they're trapped there. And that's part of, with what the Ghost Asylum program, part of the reason they would go to these places is trying to figure out why they would be trapped there. But I feel like, too, you are going to encounter, because we were talking before about people's loved ones coming and visiting them, and I wish my usual co-host Stephanie Burke was here, because she's a psychic medium and she can experience these things firsthand, and she could give us a little more insight. But I feel like when people's loved ones are going to be around them all the time, you're going to happen upon them in these places. But some of these hospitals have spirits who are there all the time and who actually will influence the living that are there. I'm sure that it must come up from time to time amongst medical professionals, at least even on a halfway joking basis. that's, when we're here alone, the lights go off and on their own. There must be some different types of weird phenomena that have happened to you or some of your colleagues.
Some strange things happen. We haven't experienced that much. One of the things I can think about, though, was a individual, one of my own patients, that he had a heart transplant, and he lived for quite a while with his heart transplant and finally died. And his family was sitting around the living room talking about how much they loved him and what influence he had on the family and so forth, and they were telling all good things about him, and they were laughing that he would love to be there to hear all these good things that everyone was saying about him. And one of the family members said, and I wonder if he could hear us now. All of a sudden, there was a surge of electricity in the lamp that was in the living room for about 5 seconds, and then it went back to the normal light. And the family decided that was his way of saying that he was there and he was listening to their conversation.
I know that in these days it's different. In modern times, you probably have a lot of patients that come in who have already self-diagnosed themselves through WebMD and, looking symptoms up on the internet, and they think that they have an idea of what they have, whether they're right or they're wrong, but at least they're coming in and they're already kind of having an idea in their head from what they've read on the internet or what they've seen on TV. Mm-hmm. Did you ever have anybody that came in and just kind of intuitively knew what was wrong with them, that it seemed like maybe they were diagnosing themselves early with something, or they just came in and seemed to have some sort of precognitive ability to know what was wrong with them?
These days medicine's gotten pretty sophisticated, and there's lots of lay literature about symptoms and so forth, and it's not unusual that I will see people in the office and they'll say, I think I've got this or that condition, and sometimes they're spot on. It's really uncanny. Many times they're way off, but
right.
But it's not unusual for a person to do some research and diagnose themselves. I can't think of a case right now where a person had a premonition of something that they came in with. I've had doctors that have had premonitions of illnesses in patients, but not so many patients. And the one that's most striking to me was Dr. Rich Jorgensen, who's a general surgeon, and he one of his good friends was an appellate judge. And one night he had an amazing dream that his friend had died, and that he was laying in a coffin in a funeral home. And it was a vivid dream. He saw him dead and died of a heart attack. So the next day he called him up and he said, I hate to say this, but I had this vivid dream. And most dreams, when you wake up in the morning, they're gone.
Right.
You forget about the dream, but this one stayed with him a long time. And he called his judge friend up and he said, listen, I had this crazy dream that you were dead. And the judge laughed. What can you do when a person says that? And he said, I'd like you to get a physical. If you could just get a physical, it'd make me happy. And so the judge agreed. He hadn't had a physical for a long time. And so he went to see a doctor. The doctor did all the important tests, and everything was perfectly normal. He said, don't worry about dying of a heart attack. You're perfectly fine. Don't listen to this Dr. Jorgensen because he's and doesn't know. He hasn't examined you, and you're going to be fine. Well, when the judge talked to Dr. Jorgensen got this sick feeling in his chest again that this was something that he felt very strongly about. And he said, I really want you to go to one of my cardiologists and have them see you, because I still feel that there's something going on here that your doctor hasn't found. And the judge very reluctantly did that. They did a stress test, they did some other tests, and found ultimately that he had end-stage coronary disease. He had what's called a widowmaker plus other coronary disease, which usually gives you a life expectancy of less than 6 months. They put him in the hospital. He had bypass surgery the next day because they were afraid to wait too long, and that literally saved his life. He had some really, really serious coronary disease. And so Dr. Jorgensen felt that this dream was really something that led him to save his life.
I mean, that's very interesting because, we talk a lot with psychics, people who have psychic abilities here on the show, and as I mentioned, my co-host does, and we talk about how when they pick up on something medical, it's very much a slippery slope for them to mention what it is they're picking up on. That usually the way they try and do it is they'll say, listen, I really feel like you should go see a doctor. I'm picking up something about your chest. And even though they might have a vision of this person having a heart attack or something, they just try and keep it very generic because they don't want to come into any problems of predicting illnesses and running the risk of giving somebody the thought in their head that they have something wrong with them when they don't. But it does happen where sometimes people do see a psychic and the psychic will tell them, you have cancer, you need to go find a doctor. And I'm sure that that's probably come across, your desk a few times that's happened where somebody's come in and told you that, a psychic told them that they had this or somebody told them that they had a feeling that they had this.
In getting back to Dr. Jorgensen again, he stuck his neck out to come up with his strong insistence that the judge see these doctors. And had he been wrong and had the judge had all these pretty invasive tests, including angiograms, he would have felt terrible. But he had such a strong feeling that something was wrong that he had to speak up. I've seen patients. I don't think I've seen a patient that has had a psychic tell them that they had something wrong.
Right, because at least with Dr. Jorgensen, he has the cachet to when he says something, it's coming from a medical opinion. No matter how he came about the feeling and the information, you know that he has that background. It's something totally different when somebody who doesn't even know what they're talking about says, "I have a feeling that you have cancer."
Yeah, and people will come in with feelings that there's something seriously wrong with them, and I'm not sure whether it's some of the hormones that are released by the cancer or whatever. We had a doc surgeon that was operating on an individual for a chest lesion, and she said to him, "I'm going to die today." And he said, "No, we're gonna do a surgery. You're gonna be just fine, and some minor surgery. We're gonna take a little spot out of your lung, and it's not a very big procedure." And she said, "No, I want to thank you for all you've done for me. I want to make sure that you understand that this is not your fault. That I'm going to die today." And he kind of blew it off a little bit, and she went into surgery. During surgery, she arrested. They couldn't get her heart going, and indeed she died. That surgeon was so spooked by that experience that anytime anyone mentions to him again that they think they're going to have a complication or they're going to die, he cancels the surgery. And he's done that a number of times right the day of surgery. And so that kind of thing happens, and I'm not sure how you can explain it, but that happens to surgeons occasionally in situations like that.
And sometimes, us patients were just really totally wrong. Like for years, I would experience headaches and I couldn't explain why. And they started to get to the point where they got really bad, and I was convinced that I had a brain tumor because my uncle had died of brain cancer at a young age. And, here I am in my 20s thinking, this is the same path I'm going down. And I was afraid to see a doctor over it. And I finally went to an eye doctor just to kind of dip my toes in the medical waters and found out I just needed glasses. So,
and that happens all the time.
Right.
So that some of those things that people think that I've got something serious going on are totally unfounded. And that's very true.
So I can tell you that I have zero medical intuition for myself, that's for sure. Sometimes when I go to the doctor, I'm way off base with what I think it is. And sometimes when it's serious, I'm like, well, I'll just wait and see what happens. So you never know which one's right. So always trust the professionals.
Right.
So as you're getting these stories and as you're collecting these stories for the book and people are starting to share them with you, it probably eventually got to the point, though, where you didn't have to ask them anymore and people were just coming and sharing with you. How did you discern what was, were there any that were just too fantastical to believe? Were there any that you're like, I couldn't put this in the book because nobody would ever believe that?
I went to people that I knew. I've known these doctors, most of these doctors, for a very long time. So I know what kind of people they are, and there were a couple doctors that had really phenomenal stories that I knew. I'm not going to mention their names, but I knew these doctors were not up and up and would tend to exaggerate a little bit.
Mm-hmm.
And I didn't include any of those stories in the book because I just wanted to make sure that these were straight arrow kind of doctors that didn't want to exaggerate at all. And so, yeah, I heard some fantastic stories that I didn't think, considering the source, I didn't think they were appropriate for the book at all. And the stories in the book are fantastic enough, and they're from these ordinary, routine doctors that have no reason to make up these amazing stories. And actually, they really stuck their neck out in telling these stories because they were afraid that they might be criticized for having these experiences.
Well, we are talking with our guest, Dr. Scott Kolbaba. The website is physiciansuntoldstories.com. That is also the name of the book. If you have any questions, 508-996-0500, 877-996-1420. Those are the numbers to call in. You can also share your questions in the chat room at SpookySouthCoast.com as well, or email them spookycrew@SpookySouthCoast.com, or on Twitter using the hashtag SpookyLive. We did talk a little bit, Doctor, in the first hour about accepting the idea of a higher power. And do you feel like with collecting these stories and with the people that you've talked to and sharing these stories, is it more of the fact, are you kind of just looking at this now, as much as you have this education and as much as you have all this experience in working in medicine, do you see yourself as kind of just a tool for this greater being to be able to take care of people?
Well, I think doctors and myself included, this is our work. We see people every day with sore throats and colds and so forth. And I don't think we're helped necessarily by a divine power for those kinds of things. But I think we are touched by a divine hand more than we realize. And again, it's not for every patient. I can think of cases where you go through a whole day and you see some ordinary routine things, and I don't think anything I don't feel anything that's made a influence on me. But there are cases where I'm recognizing more and more that maybe that hunch I had was more than just a little hunch. My partner has a strong feeling about that. Dr. Bourne is my partner. And he's had cases where, one case, for example, he was clearing a patient for surgery for an orthopedic surgeon for total joint surgery. And he, after he did the exam and physical and so forth, he had this little naggy voice in the back of his head saying his guy needs a stress test. And he tells me that he's had that experience enough that he knows when he hears this little naggy voice, whatever it is, whether it's a divine thing or just from his experience, he acts on it. And he called the individual up and he said, "You need a stress test." Well, the guy was a little hesitant to have it done, but he finally agreed, and sure enough, the stress test was very abnormal. He ended up with a bypass surgery before his main hip surgery, and that's basically saved his life. So we do have these things that happen to us that you can't quite explain, but they don't happen with every patient. For sure.
But even then, even the routine stuff still has an impact on that person's life and still has an impact on the course of the direction of their life. So in a way, you're still adjusting what fate was. Like if fate made them fall out of a tree and break their leg, then you're coming in there as a tool of fate to reset that leg and to get them on the path of being healthy instead of being somebody that has to, say, walk with a limp for the rest of their life. So it might seem like it's mundane, but in the end, it's still being a tool of some sort of greater plan.
And sometimes we forget about that. When I visit other doctors for various things, I've had a neck surgery in the past, and I'm always amazed at the skill of the doctors that I have seen personally, and the ability to go in with a little tiny scope and into the back of my neck and remove a part of a disc and basically cure a significant problem I was having with numbness and weakness in my arm. It's truly amazing to me, even in the business, to have that kind of thing happen, and it's very rewarding and very reassuring.
And I've noticed on the website, physiciansuntoldstories.com, it mentions that you've received an award from the Mayo Clinic Alumni Association. It seems like the medical community has embraced this book. Do you feel that learning about these stories, about these different types of incidents that you cover in the book, do you feel like it would be beneficial for up-and-coming medical professionals to learn these stories as part of their training? Should part of the course of study be to take a course in some of the things that might happen to you when you're working in this field, such as these?
That's one of the reasons I wrote the book, is to have people be aware that these things happen, and that to pay attention for them, and to actually use them, to count on being helped in some of your diagnoses, and also then to be able to talk with patients. That doctors should be able to talk with patients about spiritual matters that may result in healing that takes place without medication in some cases. So, yes, that was one of the purposes of writing the book. That I was hoping doctors would learn more about the spiritual side of medicine.
And in the final few moments that we have of the show, I would be remiss if I didn't bring this up. And I know you're probably expecting me to mention the Affordable Health Care Act, but I'm actually going to mention the fact that you are an award-winning pumpkin grower. And my co-host, Matt Costa, is actually very impressed with people that can grow large pumpkins. So I saw that in your bio, and I was like, well, that's definitely something that, you have to have a little bit of a metaphysical touch to be able to grow some of these mega pumpkins.
Well, we've done some strange things in our lives, and one of the things, my friends accused me of doing things in a big way, and we won. There's a local contest here called the Sycamore Pumpkin Festival, and it's one of the largest festivals in the state, interestingly, and we won that 2 years running with our largest pumpkin. We also have a large family, 7 kids. I'm not sure where they came from. We have a large dog, a Newfoundland, 142 pounds. So we try to do things in a big way in our family.
Well, that makes sense. You need large pumpkins because that's a lot of people that want pumpkin pie. So
that's for sure, and that provides a lot of pumpkin pie, pumpkin soup, and whatever.
And I know that you tease a little bit in the about the author page that there could be a second version of the book, but I'm assuming that you've been collecting enough stories that there has to be a volume 2 coming somewhere in the works.
Yeah, I'd like to do another volume of stories. I'm thinking, doctor stories. I'm collecting a number of doctor stories, and nurses have a ton of stories. Also, they're really in the trenches in the hospitals, and they see stuff, I think, sometimes more than doctors do, that are unexplainable. So I'd like to do a nurse book also. Just
really quickly, do you feel like there's less of a apprehension about sharing the stories amongst nurses than there is amongst doctors?
I think there is. I think they don't feel that the potential criticism from patients that would then avoid the practice of that individual. So nurses don't have a practice of their own in most cases. So I think there's that concern that if I come forward with these stories, patients are going to avoid me because they'll think I'm a crazy doctor, for example.
All right. Well, Dr. Scott Kolbaba, we thank you for joining us. We look forward to talking with you when the next book comes out. And thank you very much for sharing this topic that, was previously so taboo, but now we can get it out there and now we can have people actually discussing it.
Thanks, Tim. It was a pleasure.
All right. You have a great night. We'll talk soon.
Thanks.
That, again, is Dr. Scott Kolbaba. His website, physiciansuntoldstories.com. That is also the website. It's the website and it's the name of the book. So you can go to the website and you can get the book there. You can also get it wherever else books are sold. I highly recommend picking it up. It's very eye-opening, and it'll certainly make you think, too. It'll get you in the mindset a little bit of what medical professionals go through when treating us, and that they have to actually be willing to let down their guard to accept some of these stories as well. So a fascinating discussion, and certainly something that I look forward to discussing again in the future, and we would love to hear your personal stories about. Shoot us an email, spookycrew@spookysouthcoast.com, if you've ever had a strange and unusual paranormal experience related to medicine, whether you be a doctor or a nurse or a patient or what have you. So in the final moment that we have of the show, we do want to give away a pair of tickets to the Provincetown Paracon, provincetownparacon.com. If you want to get your tickets, I mentioned earlier in the show how you can win them from me on social media later on in the week. So stay tuned to my social media page and to the Provincetown Paracon Facebook page if you want to get involved with that. But I will ask this question. And the number is 508-996-0500 or 877-996-1420 if you want to win. And the question I am asking, we mentioned Dr. Elizabeth Kubler-Ross, and we mentioned about the 5 stages of grief, and we mentioned about her work with near-death experiences. So I just want to know, what is the name of the seminal work that she had that influenced the medical community on this topic. What is the name of that book that she wrote that became the standard bearer for helping physicians deal with death? And what is that book that same book also led to her with this research into near-death experiences? So if you can call in with the name of that book, 508-996-0500, the first person to do so will win a pair of tickets to the daytime Saturday event at Provincetown Paracon. And that's why we won't be here next week. There will be no show, but we will talk to you the week after that. Stay tuned to my Facebook page to win those more tickets. And until next week, for Matt, for Stephanie, for Chris, I'm Tim. Stay spooktacular.